It's really difficult to recover from medical problems on the street.
For homeless patients, just accessing health care in the first place is very, very difficult.
We were seeing that more and more homeless people were older and were developing chronic diseases, and they were coming into the hospital.
What happens is that a lot of times homeless people would go into the emergency rooms, they'd be medically stabilized, and then because they didn't have a home, they'd be discharged back to the streets, and not surprisingly, they would be recycling back through the emergency rooms.
What we needed to do was find a way to discharge people from the hospital to home when they had no home.
The staff at the Venice Family Clinic has been providing services to homeless clients since the inception of the clinic 42 years ago. But as we would attend various conferences, we'd hear about this whole concept of respite care.
We started the respite program because we saw the problem that came up over and over again. They weren't sick enough to be in the hospital, and they could just go home and recuperate if they had a home to go to. The respite program helps bridge that gap.
It's very clear that the respite collaboration has significantly reduced both inpatient and outpatient costs for homeless individuals who had previously not been part of the respite program.
There's an 80% reduction in their inpatient stay. So when they come into the emergency room, instead of being admitted, they go back to where they're living. For the first 10 patients we saw as a result of respite, we saved $300,000 over the next year.
The partnership between Venice Family Clinic and OPCC and the hospitals is one that really started years ago.
This is a community that really values collaboration and working together to solve problems.
Funding and support from the Community Clinics Initiative really helped get this off the ground.
Community Clinics Initiative enabled us to take the time we needed to plan effectively, to go to other respite and recuperative care centers and then match what they were doing with what we knew about our community.
I think one of the really successful aspects of the respite care program is really not just getting people back on their feet, but really case managing the whole housing component.
People are being housed, which has a huge impact in terms of their ability to have a higher quality of life and receive ongoing medical care.